Today I'm going to go over the adductor muscles and how to massage them. A lot of people, also known as the groin, a lot of therapists don't know how to work on this muscle very well because it's hard to maybe drape or hard to maybe get to the muscles because you feel it might be in little sensitive areas. Let's go ahead and look at them. So this is Steve, as you see. He is not a perfect replica, but he has lots of strings on him. So he has gloves on to keep him from grabbing the strings. He tends to grab them. All right, so let's put him aside. So what we're going to look at right now, here they are. You got your Pectineus. If you zoom in, this is Mary, by the way, my therapist. Connects to the back of the femur, runs up into the pubic bone, connects right there. So it's a little muscle, but does a whole lot. Remember, these muscles are going to pull the leg inward. And then also, if they're pulling from the back also, so it's an internal rotation like that. So if you see a lot of clients who have their femur pulling this way, that's because those adductors. Usually that means they're weak on the abductors. So we need to strengthen them. So the Pectineus, we got the adductor Brevis. That's another one on the back of the femur. I'll show you all the back side in a minute. Connects to the same place. Then we're getting a little bit bigger. Going to the longus, which is the green one right here. Hence, it's real long. All the way through here. This is the one you're probably going to be working up in, And then we got the Magnus, which is the blue. I know it's not perfect. Here's another view of it on this side. Connects right there, runs up under, and there. It actually runs up in here too. So, like I said, these muscles get tight. It's going to pull that direction. And then when that happens, the tibia tries to pull the other way to straighten you out, which can cause a lot of issues. Did you know that, Mary? She's like, I'm off now. I'm doing you a favor. Don't throw me questions. All right. Now, the one y'all may know, the Gracilis muscle, that's that good muscle that runs all the way to the inner of the tibia, all the way across, connects in by the knee, and then goes all the way up. Okay? And then I'm going to show y'all on Miss Mary how to do the massage on these muscles. But first, I'm going to turn him over. So, Mary, if you'd hit pause. All right, now we got him face down. Ready for his full massage. Look at all these muscles. So these are the adductor muscles from the back side. They connect on the back of the femur. As you see, like I said, it pulls this direction, so internal rotation of that. You strengthen these gluteus medius muscle, the gluteus minimus, it's going to pull back. So that's one cool fact. The other thing is the adductors, y'all may not know, is the second largest of the three major groups of leg muscles, and that would be the hamstrings, the quads, and then the adductors. And the abductors, well, the adductors are the ones that are second place as far as size, first place being the quads. So, one of the cool moves I like getting in, you can actually turn their leg that way and kind of get in, up and under into there. But I'll show you all that on Mary in just a little bit. And I'm going to show you how to do the draping. And remember, when it comes to this, you want to be very communicative. Tell them exactly what you're doing. Ask them for permission. That way there's no confusion as far as that goes. All right. See you in a second. And we're back. Now Mary has popped on the table. So now I'm going to act as if Mary is a client. And, Mary's low back hurts a lot, a lot of rotation issues in her hips. I'm going to ask, hey, do you mind if I work on your groin? I don't say, do you mind if I work on your adductors? Because they're going to be like, well, what the heck is that? So I'm going to say, Mary, do you mind if we work on your groin today? Now, as far as groin, I'm going to also tell them what that actually means. And, because they hear groin, they don't know how far up, they don't know any of that. So what I'll tell them, after I ask that, I say, and here's the areas I'm going to work. Now, first thing I'm going to do is undrape, and I haven't gotten the answer from her, but I'll finish that in a second. But I want to, she's like, but what if I said no? I'm like, you already laid here. You've consented by laying down. Okay. Okay, so now this is a good drape. You could always lift up the leg a little bit, tuck under, make sure they're good and tucked. Now, I'm probably going to run up through here. I'll start working through here. I don't know, Brittany, if you can see. Don't worry, Mary, you are completely covered in our video. But now there are certain areas that I'm going to work my way up, but have good communication as I go. So I'll show you what I mean. So let's say, Mary, do you mind if I work on your groin today?
Yes, I might. Wait, no.
Yes, I mind. Okay. She's throwing off my video, guys. Okay, so like I said, she's here now. So, all right, now, noticing a lot of tension right in here. You feel that?
Yep.
All right. Remember, get some good warmed up. When I work on any muscle groups, I try to put that muscle in a lengthened state and then in a shortened state. You'll see what I mean in just a second, because I want to work in it in different positions. Helps it release a little bit better. So, but this is not a hamstring video and all that, so I'm just going to go over how I would do the groin. So first, going across. This isn't the adductor yet, or hitting maybe a little bit of it. Remember how the femur up and down, you had some that were crossing over and going up toward the pubic bones. Obviously, we're not going to be working on a pubic bone. There is a good pubic bone alignment you can do. So what I like to do first, we're going to put a forearm here. I'm not digging in with an elbow. A forearm, and then I'm going to go across slowly. Now, when I feel a tight spot, I'm going to just sit on it a sec and let it relax. Kind of like a pumping motion. Yeah. Going across. How are you doing with pressure?
Good.
Now, one thing I would also mention, don't just say, how's the pressure? Because most clients are going to say it's fine. You know, ask them, you know, do you prefer deeper, lighter, just kind of stay where we're at. You see, I'm working across first. That's why it's good to know the landmarks. All right. Now I've kind of warmed it up. So here's my first step when it comes to working these muscles. So I'm going to sit on the inside because I get tired. No, that was a joke. They're like, you're not funny. Okay, so now that her leg, I put it kind of in my arm like this, and then my bicep. Just crutched like that. Remember, I go across this direction, across the muscle group. Okay. Now, if she's a new client, what I'm going to do is I'm going to start with one area. I'm going to go across, then I'm going to work the next. And then as I feel like I'm getting towards a barrier, you know, I'm going to ask, okay, do you mind if I go a little higher? You know, communicate as you go. I probably wouldn't even do this to a brand new person, just because I want to make sure they're completely comfortable with me. But, so my elbow's right. Across it. Now I'm not trying to put just elbow in there, otherwise that would be very mean. It's more of a forearm to elbow. A little tender up there?
A little bit.
Yeah. So she's tender up top where some of those hamstring muscles connect right here in the back of the femur. Feel that? That's that good origin of those. her spidey senses are tingling. Like, nope, that's just my knee. Oh, okay. Okay, so now, I don't know if you can see how high I've kind of went. I have the barrier with the sheet right now. If I felt she needed it, she's had chronic pain all the time. I've done a lot of this other work before. I've worked on her several times. Like I said, then I'll, I always make sure they know I can always stop at any second if you ever feel uncomfortable. You're not going to offend me, so I want you comfortable. So I'm gonna work my way down. So I go straight down towards the table with my elbow. Now I'm gonna come up into it. And then relax, down, and then up. That was a good, ooh. That was a you got the spot. Okay. Why did I sign up for this? All right, so now what I can also do while hitting that spot is have her push her foot towards my hand. Push this hand, there you go. And relax. And then I can have her do the opposite. Come towards me inwards. And relax, good. Another thing I like to do, kind of like I showed y'all on Steve, is Brittany, we'll come on this side, right towards the end of the table. So right there, that's good. So I like to get my good position. I'm going to sink down towards the table, like my elbows almost touching the table. And I'm going to slide up. It feels heavenly. That's why she's taking deep breaths to breathe in the moment. All right. All right. And Mary, do you mind if I go a little higher? Okay. I'm going to slide up and into there. Good. Holding this leg's good because it keeps her from kicking me in the face. And relax, good. And go across, and go across. You can do forearm, you can do palm. Good. So we've done them that way. Mary, will you bring your knee out and up? Bend it. Good. So what I like to do as well, so in this figure 4 position she's in, the pelvic line's right here, up and down. I'm going to put my forearm along the line and then just sink in. Do you feel that in your groin at all?
A little bit.
A little? Okay. Now watch this move. Push your knee down to the table. And relax, good. Now I'm going to sink lower towards the piriformis muscles. I said muscles. There's only one piriformis on this side. But that's okay. Push down. Relax. A little bit lower. Push down. Relax. That really opens the pelvis up. Let's bring this down. I feel like your pelvis is a lot more open now. Whatever I say, that sounds good. All right, go ahead and turn over, Mary. I pull the sheet above her head and then guide it around. All right. It's bright. Thank you for calling me bright. All right, so we're still on this leg. So as far as working the inner, if you have a blanket, I like to get that kind of out of the way a little bit because it's harder to see through a blanket, but we're going to line it up. Good. There we go. Bring the knee out. And you can actually even remove the bolster. This tells me how tight our groin is too, because when I go down, Everything's trying to move with it. Brittany's laughing at you. Brittany's my videographer.
Just happy that she's not the one.
She knows how this feels. Okay, so I draped about there. Now, there's different methods to find out how close how far is their comfort zone. If I'm really want to make sure that I don't cross any barriers, what I'm going to do, first I'm going to let her know, okay, I'm going to be working on your groin. I'm going to tell her why. And I'm actually going to have her point to where she wants me to stop. So it's going up this way. Can you just point where, kind of like in this area?
Yeah.
Okay. So she's comfortable as long as we stay above this area. Now I know there's plenty of communication. So, and then, different people are going to have different comfortabilities. So it's good to just stay within that. And if anything, like I said, if they're, into a lot of sports and stuff like that, they may need a lot of detailed groin work. And in that case, and they're pretty comfortable with almost anything, and you develop that relationship, maybe have them wear some, shorts or something like that. That way you can, like the smaller shorts. That way it's a little bit easier. So, going through here. Warming it up. There's her breathing again. Saying, this is great.
Feels amazing.
See? Feels amazing. All right, so again, I'm just going to sit down. It is okay to sit. All right. Remember, this doesn't require much pressure. And don't just get the top part. Try to also get through here. Remember, it connects into the back of the femur. So that's on this side. I don't know if you can see, Britt. All right. So first thing, I'm going to come under. Now, I don't want to go straight through the muscle like that. I want to kind of do a cross fiber going across. So here we go. First thing, I'm going to sink in a little. I probably sunk in a little bit too fast, but... And relax. Like I said, a pump in motion. What I mean by that is, hold down for 5 seconds, let up, hold down. And then the windshield wiper. And we're going to go up a little higher. Hold. And then the windshield wiper. I can go lighter if needed.
Not again.
She's good. All right. Then we're going to when you feel that area of tension, just hold that. It's usually pretty easy to find. You can always communicate with them or read their body. So the next thing I'm going to do, I'm going to hold one of those tough spots. And I'm going to have her push down her knee towards my hand on the bottom. Right here. Let go. If they're making that noise, you're probably pushing too hard. Just lighten up. Push down. Let go. Good. Now, I don't know if y'all know if they have an impingement when they cross their knee over that hip and their groin hurts. That's an impingement. These are really good for that. The spot specifically, kind of like an X right there. It can go a little higher, kind of like right here. You'll feel a little band. You feel that band of tension right there?
Mm-hmm.
Yes, she does. All right, I'm going to just sink right there. And then I'm going to have her bring her knee up towards my face. Just don't kick me. Let go. I don't think she finds my jokes funny. Thank you. Push your knee up. It's not something you're going to do to every client, but it's one of the things they'll thank you for afterwards. And relax. Good. Now, when on the other side, we're going to just spread blood flow. Now, going to do is we're going to stretch it out a little bit. What I like to do, put their heel into your hip. That way when they push, it can give you a good massage right here. I'm kidding again. All right, so here we go. One test to know if they need this work, definitely, I can tell on the other side she needs it. I don't know if you can see in the video, but like when I come down here and come up, now she's trying to force it down, I think. But this leg like naturally pulled in, so it was real tight. So what I'm gonna do now is I'm just gonna put my forearm on top. I'm gonna hold here. Don't hold the knee, hold it on top. Oops, she's fighting that. Here we go.
Pitch out.
There's a pinch. All right, push me with your heel. Relax. Push. Relax. Push. Feel the stretch. Relax. Next, we're going to come around. Now, don't grab the knee, but you can come under the femur a little bit. I'm going to turn and lean in. And relax. Relax. Another cool move I'll show you real quick. You can sit on top of the foot, just not directly on top where it hurts. Grab the quad, pull, and relax. Push your glute down to the table. Relax. Good. Good. Lastly, let's go ahead and show y'all that pubic bone alignment. Do we have this cat dog? I was looking at her socks. Sorry, guys. Just cat dog and Hey Arnold going on. Comment below if you've seen that show. I have. Okay. I used to watch it all the time. All right. Bring these knees up, both of them. Alone in the world with a little cat dog. That cat was rude. All right. So I'm going to put my arm into the inner knee on both sides. I'm going to tell him squeeze hard as you can. You're not going to break my arm. So go, 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 squeeze. And then raise your butt up. Squeeze and relax. You might hear a click sometimes. Go ahead again. One more. Don't have a hernia. Just relax and relax. All right. Thank you, Mary. And thank you, Brittany, for being my videographer today. And thank you, Steve, for being you gotta look at Steve. He did a great job today. He lost a tooth today during that thing. So if y'all could comment below y'all's thoughts, and I appreciate everything. Hit subscribe, like, share it with the world. You know, we're almost to 3,000 hours watched. So if you could please help us out and share it with your friends. Follow us on Instagram. We're on Facebook, on YouTube, on TikTok. If you just follow us on all those things, that would be great. And y'all have a great day, and we'll see y'all next time.